We are back on Morning Line. Thanks for joining us. Dr. Joshua Beckman is with us from over at Vanderbilt, the Heart and Vascular Institute. Talking heart health this morning. If you'd like to join in the conversation, jump in. Some good questions this morning, 737-7587. Vast majority of the population, of course, is on a statin. I shouldn't say majority. Of folks who are dealing with heart issues sometimes are on that. And more people do use them when they need help. But you always say there can be other ways to address these issues. What's more important, exercise or diet? Yeah, I knew it. I knew that was the answer.
Well, you know, I think that they're both important because they're complementary. They're not, one doesn't substitute for the other. And they do different things. I think the diet is incredibly important for weight and management of things like your cholesterol. But if you exercise regularly, you will feel better, and your heart will be more efficient. And so and your aerobic health will be good. There's no bargaining with reality. It is. So you can try, but I would say, let's put it this way: modest efforts in both are better than killing yourself in one.
All right. And is it fair to say that body weight necessarily is an influence on heart health? Because I have some good friends of mine who are a little bit more, I think their natural way of being is a little bit better. They're at the gym, they're working out, they're doing fine, they're eating healthy, but they are bigger. I wouldn't say fat, but they're bigger people. And I'm wondering, as opposed to someone who's just rail thin, my attitude is that either one of them could have heart disease.
So there are colleagues of mine who are at Vanderbilt who are doing some research in this very question. And I think the answer is going to be that things are associated. So, for example, being heavier is associated with, say, worse cholesterol profiles or higher blood pressure, but it's not a one-to-one correlation. And there are people who exercise and people who eat well, and they may not have the bad consequences like high blood pressure and bad cholesterol. That said, there are thin people who, and I just have this picture in my mind of someone who sits there smoking all the time, right? Who doesn't do much activity, so they don't eat either because they're just smoking all the time. They're not healthy either.
No.
So you can be thin and unhealthy, and you can be heavier and unhealthy. The heavier brings with it more commonly things like high blood pressure and bad cholesterol. And diabetes, for example.
And diabetes.
Right.
So is body mass index, BMI, an important measuring tool anymore, or not so much?
No, we still use it. It's a good way to understand your weight in terms of how tall you are. And so, LeBron James may have a body mass index of 27, and you may have a body index of 24, 23, somewhere in there, right? And LeBron James weighs easily 100, maybe 125 pounds more than you.
Sure.
And so he is appropriate for his height, and you are appropriate for your height. And it allows us to understand in general what to tell somebody about their height, about their weight.
Because Scripps, the company that owns this station and many others, has a pretty good program. They come in and we do the body mass index. By the way, we do the blood test.
Yeah.
Is the blood test any more accurate if they draw it from your arm here or do it from a finger, prick?
It's not, that difference is not important enough to really care about.
Okay, because when I asked them that when they did, I said, well, how are you going to tell from a little one? They usually take a bunch. They take a bunch there because they're doing a bunch of tests. They need more blood.
But
the blood from your finger is no different from the blood from your arm, probably.
As far as I know.
Right? There'd be no reason why the cholesterol would be different if you're just testing a smaller sample.
No, that's right.
All right.
It's an accurate way to do it. And if you're lucky enough to have your employer come in and do these health days, totally take advantage of it. I mean, I understand that it can be difficult to get to the doctor. I'm a difficult person. And so when that's the situation, you should take advantage of it, especially if it's in line with your day. I mean, I understand what it's like.
Absolutely. They work it to do that. It's fantastic. And I think most people here are smart, and they do it. Why wouldn't you? It's just, we actually get incentives, financial incentives to do it.
Yeah.
Which,
Well, that there's, it's been well studied and shown that if you can help your employees control their risk factors better, they are absent from work less.
More productive.
That's
More
right.
productive. It's just smart business.
Because they feel better.
Absolutely. Let's go to Linda. Linda, good morning. Hi, Linda.
Yes, I have a question. I have a heart murmur, and how dangerous is that heart murmur? I've had it for years.
A murmur.
So that's a wonderful question. there's a variety of kinds of heart murmurs. So we have 4 heart valves. And what the heart valves do is they make sure that there's no backflow after one of the 4 chambers of the heart pumps the blood forward. So they're supposed to close and allow no backflow. You can get a murmur in one of 2 ways. Either it's not opening enough, and so the blood is moving through a small area, or it's not closing at all, and you can get backwards flow regurgitation. Any one of those can cause a murmur. And sometimes murmurs can be quiet for or modest and not make you feel bad for a long time. And sometimes murmurs can be quiet or not bother you at all, and then you get symptoms and they're a problem. So
what would a symptom be for a murmur?
So there's a variety of types. There's shortness of breath, there's fainting, there's chest pain. Shortness of breath, if you just looked at all the valves, would probably be the most common. And I would say that we generally don't want to wait until there's symptoms. If your heart is showing signs of strain before you get the symptoms, we could fix your valve so you never get the symptoms. So I would definitely talk to your doctor and just make sure that they're following you up for the murmur itself.
You just go in and fix the valve?
Yeah, you know.
Replace it with a pig's aorta?
So sometimes we replace the valve. Sometimes you can, say for example, for the mitral valve, you can clip them. And so we are moving towards doing more and more of these valves without actually cutting open the chest.
Wow. It's incredible when I think about all the work that our amazing hearts do for our body. And it is an incredible, incredible machine. That doesn't happen more often. I would just think, you know, like anything, in my heart, and I'm a healthy person, that at some point, one of my valves is going to leave the window open for a while. It's just going to happen. I don't know. Maybe it does as you get older, but it's just incredible that we don't see more of that with more people. It's an amazing thing that it maintains itself and works like a clock.
So I think it happens more than we see.
Does it? Okay.
Because people, if they see their doctor and they have a murmur, they get followed up. But you know, I think it's also important to know that a lot of times we can fix a valve and people can go right back to feeling well. And you want a good example? Mick Jagger.
Okay. Mick
Jagger was not feeling well, had his aortic valve fixed, and he's now currently on tour.
That's right. That's what it was. For he had. I remember at first it was a little quiet, and that's fine. Then I think he went public with it and let it know what it was. An aortic valve. So he had. He noticed some of those symptoms. It wasn't closing, and that probably came with age with him. Maybe he's in his 70s.
That's right. So his wasn't opening well. That was his problem. And they went in. They didn't need surgery, and they just put in one of those implantable valves.
And that would have been through like an arthroscopic type thing through the chest, or
angiographic, probably with a plastic tube catheter. Right through the groin artery.
And then up, and they were able to follow it up there, and then just clip it. And it's a great example. Mick Jagger, he's coming to Nashville this summer.
That's right.
Wow. All right, let's go to Monica next. Monica, good morning. Hi, Monica.
Hi.
Hey, go ahead. What's your question?
I'm 65. For many years, since my 40s, I've had bradycardia, which is no big problem. My blood pressure is normal to low. And yet, a couple of years back, I was diagnosed with something called left ventricular diastolic dysfunction and pulmonary hypertension. Now, I haven't had a right heart cath. I have many different things. I have autoimmune conditions and stuff, so I don't think they actually know what's causing it. They may be assuming that the LVDD is causing it, but what my main question is, what all can they find out from doing a right heart cath, which I haven't had yet? Is it just pressures, or can they tell reasons? And I'm going to hang up so that I can hear the answer.
Thank you. Thank you for your call, ma'am.
Well, that's a great question. So let me define some terms first.
Okay.
The left ventricle is the main pumping chamber of the heart.
It's on the left.
Exactly right. And it pumps blood all the way around the body. That was spectacular. Okay. And then the diastolic dysfunction is stiffness. So what generally happens before we have that dilation we were talking about is the heart gets stiff in response to higher pressures. She's right. The slow heart rate doesn't matter because she hasn't had any fainting or difficulty doing activities. Pulmonary hypertension, in contrast to the rest of the body, is when the pressures are high in the lung. And it's a blood vessel problem that can occur for a variety of reasons, and sometimes it can cause people shortness of breath. And if it gets really bad, it could be a big problem, just like anything else. Now, she didn't mention any shortness of breath, so it doesn't seem like it's been as big an issue because she's had it for years. A right heart catheterization, complicated term, that's when we put in again, the plastic tube into the veins, not the arteries, and we shimmy it up. It goes into the right atrium and then the right ventricle, small pumping, big pumping. That side pumps through the lungs. And then we can put that tube into the lungs and measure the pressures. Why is that important? It allows us to have a much better understanding of what your cardiac output is, how well and efficiently it's working, what the pressures are on the right side of the heart, and it can give us an isolated lung number and separate out what's going on with the left part of the heart from the lungs. And so for her, it could give the doctors information about where the problem starts. So a very complicated issue, not all of us dealing with that kind of thing, but it's a very good measure for a pretty low risk procedure.
Wow. She knew her stuff. She's been through this.
Oh yeah, no, she's clearly paid attention.
All right. I was just wondering, and in this news business, probably what you do as well, you get in early. What role can coffee play with your heart, or what effect, rather, is the better question? Coffee, and I guess more specifically, I guess it would be caffeine.
Yeah, so I'll say that for the vast majority of us, it's not a big deal either way.
In moderation. I mean, not pot after pot, but...
Yes, I wouldn't have pot after pot of coffee, but... The way most of us drink coffee, it's really not a problem. There are a few people whose hearts are sensitive and they can get more palpitations. And sometimes if they're already predisposed to having a rhythm problem, this could tip it off. But that is a really small number of people.
So we'll drink, but now sometimes I really think if I drink some coffee, maybe some that's more caffeinated than I'm used to, and I don't drink a lot, maybe a cup.
Yeah.
It almost feels sometimes as though my metabolism's increased, and that it feels as though that my heart's beating a little faster. I don't know.
And actually, that's probably
is that just
true.
in my head, or
no, that's probably right. But it's not.
I mean, it's not hurting me.
That's right. It's not hurting you at all.
But it speeds up, or if I have a cup of coffee before I take a swim, I'd like to do laps. It seems like I have more energy. I can do it easier. I don't know.
That may be the case.
Caffeine or
it
whatever?
Could be. Okay. I mean, I think caffeine works. Caffeine certainly helps in the waking process for a lot of folks. The biggest complication of coffee is the day you don't drink it and you get the headache.
Right. Yeah. And I don't want to get to the point where I'm that addicted. I can go day and not make, because I only have one cup.
Yeah.
But I know of people in this very building that might go through a pot. I don't know how they do, especially some of the coffee we sometimes get here. But I mean, a pot of coffee, I mean, that's a whole other issue, I think.
Yeah, I mean, look, what is the thing that we're supposed to have in great excess? Nothing.
No.
Right? So.
Well, Cheetos.
Only
the puff.
The puff. That's fine.
Okay.
That's right.
Let's go to Tracy. Tracy, good morning. Hi, Tracy.
Good morning.
Good morning. How can we help you?
Yes, I have a question regarding heart disease. What studies that have been done when it relates to rheumatoid arthritis?
That's a really good question. So we think about, for heart disease, what we're generally talking about is blockages of the arteries of the heart, the blood vessels of the heart. And so there's a couple of different ways to get there. One of them is with too high cholesterol. That's a good one that we want to try and avoid. The other process is called inflammation. Now, inflammation is hard to picture in your head, so I'm going to give you the standard way I try and describe it. If you burn yourself and your skin gets red, warm, tender, and swollen, it's inflamed. And so you can have this chronic level of inflammation that participates in creating the cholesterol blockages, the cholesterol plaques. When you have a disease like rheumatoid arthritis or other rheumatologic diseases, you can have a higher level of inflammation, even though it may not be originating in the blood vessels or with cholesterol, and it can drive the process forward. This has been shown most in younger women, and younger women will have a higher rate of heart disease because of the rheumatoid arthritis or lupus or things like that.
Interesting. Wow, that's a good. That makes sense. It makes sense, though, the way you described it. Inflammation, not a good thing.
Exactly. And so, but the best way to treat it is to treat your rheumatoid arthritis or other rheumatologic diseases and bring down the inflammation.
And that affects everything. All right, we'll take a break on that note. Great questions. We'll be back with more in our final segment with our guest, the doctor, right after this.